everybody, John Kublank here, and welcome to another episode of Off the Cuff, All Things Healthcare. And I have the pleasure and honor and all around goodwill and joy to get to do this with my good friend and the most amazing nurse in the world, Miss Arlene Maxim. How are you, Arlene?
I'm good, John. How are you? It's been a minute.
It has.
Yeah,
You look great.
Since we've done. Yeah. Well, thank you, John.
Florida has been working well for you.
Florida, yeah, it's the Florida sunshine, that's for sure. Yeah, we had our first 90-degree weather 2 days ago. I mean, we've had it consistently now, but it's getting more humid. But I just love this weather. So yeah. So I'm happy to be here.
And we have an amazing guest today.
We do. Christina Andrews is here with me, and Christina and I work together in thought leadership on the professional services team, on training certification at Access. We do a lot of things together as a team. I've asked Christina to join us in talking about AGILE, which is it's a premier event in the industry, and it's fairly new. This is our third year doing AGILE. It's fairly new, but it's such an amazing conference, John. And I know that you have not been, and you are going to come this time. And so everybody's welcome to come and meet John and I at the conference.
It will be 2 days or a few days before my birthday, so it'll be
hey,
great birthday gift to yourself.
We've got to celebrate. So things are changing in our industry. Of course, they have been changing for a number of years. However, with this new administration, I really am excited about what we're going to see going forward. I really believe that with, whatever people have, political views they have on DOGE, I really believe at some point, somebody at DOGE is going to realize that home health care is where it's at. And this is where they're going to save the money. That's what they're looking at now, is how to save money. So the best place to do that, to avoid infections, to avoid medical mistakes, all of those things are in the home. And those are all the things that cost so much money. So AGILE, and Christina's going to talk about this too, is an industry event. It is not an Access event. There will be things available to folks about Access if they choose to listen to that. However, 99% of the conference is an industry conference. So we're bringing the best and the brightest minds to the conference. I've heard that from multiple people who attend many conferences in a year, that the AGILE conference is the best they've ever gone to. And I encourage everyone, and we're going to put up some registration information here in a minute. I encourage everybody to attend. Like I said, you'll be able to meet Christina, John, and I, and I'll be speaking on how to use your intake process and discharge process to elevate your value-based purchasing. So those of you who did not get a bonus this year from CMS, you should have, but some folks weren't prepared. And so if you did not get a bonus, or even if you did get a bonus, I would encourage you to sign up for the master class that we have. I think that's on Monday, isn't it, Christine? I'm not positive.
Yes.
Monday.
Yep. The home
Monday
health.
afternoon.
Yeah, the home health master class is being hosted on Monday. And for that particular session, we have it listed for 2 Central until 5 Central. And I think, Arlene, to your point, that particular session is really going to take a deep dive into how to optimize revenue, right? I mean, at the end of the day, we need the revenue to improve our margins so we can continue to invest back into patient care delivery. So it's a fun spin on the name. We've coined it Home Health Masterclass, Decoding Medicare Reimbursement. So this comprehensive session is going to dive into the intricacies of Medicare reimbursement models, helping to equip the attendees with tools and insights that's really going to help them thrive today, but to be able to lean into the future landscape of healthcare. So we're going to dabble a little bit in PDGM, the patient-driven grouping models, as Arlene mentioned, home health value-based purchasing. And then we're also going to explore a little bit about the team episode management payment model. So really, this is going to be a fun, interactive TED Talk approach for this session. And we have quite a few speakers that, so in addition to Arlene, we're going to have Angela Huff, who is a senior managing consultant at Forbes Mazar. Chris Ataya, who is the VP of Product Strategy at SHIP, which many know, of SHIP. We're also going to have Michael Brentz, who actually just came from Common Spirit at Home. Many people probably know that national organization, but he joined Symmetry, who used to be Simeone, as the managing director of technology consulting. And our very own Mike Carr, who is our senior product director, all things home health. So he's really, I mean, I feel like he's really kind of spun this into a fun, interactive. So although I mentioned the time is from 2 to 5, it's going to go by really fast. And our goal is for each attendee to walk away with practical, actionable insights that they can apply immediately and operationalize when they get back to their organizations.
I find that it's becoming harder for organizations to invest in conferences or things that are outside of just taking care of patients because it's hard for them to see the value. But we have to take a different approach, and we have to not only learn, but I think it's the networking coming together. Hey, what are you doing over there? What are we doing? How can we improve together? Is kind of another bigger piece to this, right? It's like there's a lot of value that is going to be for the agency in the short term and in the long run as well.
Yeah, and John, I love that you brought that up. Arlene and I noodled on this last year. That's my word. I love noodle. We noodled on this last year. So if we think about it, just in that session, right, you have 4 faculty members. And if you were to hire Arlene Maxim to come into your office as a consultant, you got an hourly rate of what? If you hire Symmetry to come into your office, you got an hourly rate of what? So if you put all of Forbes Mazar, Access Consulting, if you put all of that into one package, that's a hefty consulting fee. Right. So if you look at the price of this conference, and that's only one session, you would be looking at over $1,000 plus, right?
Right.
So for one session at the price point for Agile, you're going to get in-depth consultative practical insights. Now, granted, we have multiple other sessions for that Agile price point, right? So it's not just the home health masterclass. We've also put together a HOPE intensive workshop. So for the industry who is like, how do I prepare for HOPE? What do I need to do to even begin to conceptualize how to operationalize and educate my team? On that same day, we're going to have a HOPE intensive from 1 to 4, and it's going to be, again, designed to help people not only learn what the hospice outcomes and patient evaluation is from start to finish, but it's also going to help them to operationalize it. And during that workshop, we're going to have exclusive tooltips, education sessions, templates, checklists, anything and everything that you can possibly imagine as I call it a toolbox that you would need for your toolbox. And so for that session, we've got Jennifer Kennedy from CHAP, VP of Compliance. We've got Greg Gerbowski, who's a managing partner at Hospice Advisors. And we have 2 of our very own Accessians, Rayanne Melton, who is the Director of Clinical Services, who is all things HOPE. And then Amy Rose, our Senior Product Director for Access. So again, if you package that price point, those are only 2 sessions, and that's on the first day. We haven't even started to talk about Tuesday and Wednesday.
Now, yeah, Christina, a couple of years ago, and I need to try to find, maybe Jonathan can help me. Jonathan works with Access and the communications team. Maybe he can help me find this, but I wrote a white paper on the benefit of conferences. And, the thing is, if you look at conferences in the correct way, you
Right.
really can't afford to miss conferences.
Right.
And I know people get conferences inundated and they're going, all over the place. In fact, right now, it's unfortunate there's so many conferences held in that same couple weeks that Agile is being held, but a lot of state conferences and that kind of thing. Of course, spring, that's what happens in the spring. However, if you identify one conference, it's going to be the best one and give you the most information that is going to give you improved revenue, improved quality, improve your value-based purchasing scores. Agile is the one.
Yeah.
I mean, I don't know what else to say. I'm going to try to find that paper and I'll attach it to the podcast if I can. But I think it's worth taking a read. The other thing I would encourage people to do is prior to Agile, look and see who's going to be there. Look and see what the sponsors are. Communicate with them, email them, let them know you're coming, look them up when you get there and have a conversation with them. I think a lot of, like John was saying earlier, a lot of what you get with the interrelationships with folks come out of dinners and lunches and breaks. We're sitting around the table and just talking about things, and you can come up with an awful lot of good ideas and a lot of good information from just plain old folks that are there to listen just like you. And some things that you just never ever thought about. So conferences in general, I think you have to be selective. But I do think that if you have to pick one conference in the year, Agile's one to go to. And I've been to hundreds and I've spoken to hundreds of conferences. I know thereof what I speak.
Well, I think one of the things that you said, Christina, that really stuck out to me as somebody who is an operator of a home care organization, we can go to conferences for the high level, the theoretical, the okay, I left with 7 PowerPoint presentations, but can we leave with something operational?
That's right.
Am I able to put this into play back in do I feel confident that I can do it when I leave Dallas, when I leave this conference and I go home? Can I make a difference in my agency? And what I'm hearing from you and what I've heard from Arlene is this is the place to be able to make that happen, that you're going to get the theory, you're going to get the understanding, but then you're going to be able to actually put it into play.
That's right.
John, it's almost like you and I had a pre-call before this conversation. So a few Fridays ago, the professional services team, we met, and I had talked about the fact of, attending conferences. I come home with a book full of notes, right? And I've got these notes and that notes, and I know I can download the PowerPoints, and I get back to the organization, I'm all fired up. I'm like, yeah, I'm going to do this. And then guess what? I get back into my same routine. My same routine. So I'm like, we have to think a little bit differently about these practical insights. So for Agile attendees, we are actually creating an innovation insights playbook. So for every single one of our sessions, mind you, we have 2 general sessions, we have 8 concurrent sessions, and we have the 2 intensives that I've already spoken about. For each of those sessions, we are putting together a playbook that takes the practical insights and places it into a design, a collateral, as I would say, that's going to be a checklist. That's going to be a answer and question, or a question and answer format. So when you get back to your organizations, it is going to be a tangible item where we have prepackaged everything for you to have strategic, elevated conversations based upon the Agile thought leadership. So for example, one of our sessions will be focused on AI for the hospice and palliative industry. Now, back in the day, if you would have asked me, how am I utilizing technology as an ecosystem to drive workforce well-being and financial well-being, I don't know if I could have answered that question as an operator 10 years ago. But today, we want you to be able to answer that question. So we are designing a specific AI technology ecosystem readiness checklist for you to sit down as a C-suite, as an executive suite, and have that interactive conversation and just go through and say, yes, we're ready, or no, we're not ready, and what do we need to consider? So that's an example. So for each of our sessions, we are putting together a practical insight for you to be able to take home, use, and operationalize, and not just lose your book, when you get back to your office. Not that I would lose my book, but
Yeah, and those are really good points. And and the thing is, we can't do things the way we've always done them.
No.
And I think that's especially in our industry, for however it happened, that's the way we work from day to day. Well, that's just because that's the way we've always done them, and we have to change. And so this is part of what we'll do here is change management ideas for folks that are interested in making the changes that are necessary. And you're right, Christina, technology, it's going to be amazing at what we see over the next 10 years and what technology can do. We have things available right now with that is useful in hospice and home care. As far as technology, remote care monitoring is very simple. It's very, very useful and can save organizations a whole bunch of money. So we'll talk about that at the conference as well.
Yeah, I think the one thing that I've noticed this year, these past couple of years, is that there is a change of the leadership of these home care agencies being more apt to trying new technology. 10 years ago, it was like, nope, we don't want to try it. We're not going to do it. Always the easiest one was the nurses are not going to adopt it, so why even try? But now I definitely see much more of an aggressive stance to adopting and trying new technology. Just one that we're utilizing is what's on this call. This Fireflies.ai has been a game changer for my organization. And it's so much so that I don't even want to tell people about it because it's such a game changer. But these are the sort of tools that we need to at least be showing everybody that are out there and that it's possible, and that we're taking these chances. Invoke, Notices, all these different things that y'all have available inside of Access as well, that it makes my clinician's job easier and more efficient, more effective, better outcomes for our patients, better value-based purchasing scores, you name it.
Yeah. And when I think about both of our AI sessions, we have one that's focused on hospice and palliative, and we have one that's focused on home health and home care. That was intentional, right? And so both of those sessions are going to talk about how AI is an augmentation of your staff, right?
That's right.
It's to ensure that your FTE model is being used to its fullest, right? And it also will help you as an operator to think a little bit differently about your FTE model. So instead of riffing, which nobody likes a riff, how could you allocate that resource differently within your FTE model?
Yep.
So it is about augmentation, it's about efficiency, but at the end of the day, this is what I always say, John, it is about the employee well-being. If technology gets in the way, then it's not going to enhance their well-being, and ultimately that patient care is not going to be exactly where we want it to be from a quality perspective. And we know if quality is not at the forefront, then that's the domino effect of everything financial, right? As well as growth. So augmentation, the use of your FTE model, repurposing, there's a lot that we can think. And so one last thought as you were talking, when we think about the generations today and the generations to come, it is allowing us to see things a bit differently, right? So how I led as an operator 10 years ago, most likely if I was an operator today, I would be doing things differently.
Right.
So I think that is giving us the opportunity to grow and to think outside the box because of the new generations that are working within the care at home industry. And I know right now we have 5, and primarily it's the millennials. I think they're around 75 or 80% of our workforce right now. But anyhow.
Yeah. So one thing that I was thinking about too, it sounds like there's a lot of really intense stuff. If you are new to the industry, is this going to be over your head potentially, or is this going to be manageable for all range of skill sets and experience?
Great question, John. So as we meet with each of our faculty, we actually set the tone of ensuring that we are designing the thought leadership content to meet all needs. So whether you've been in the industry 20 plus years, or you've just now launched into the industry within the last year. So we're very intentional to make sure we're setting the tone and we're helping them to journey throughout that content portion of the sessions. We also, one of the new things that we did for Agile this year is we conducted an educational survey. So for all past attendees, as well as clients for Access, we asked them, what are your current pain points? What do you want to learn about? If you had to prioritize your learning journey, how would you prioritize that? And then we packaged, what that needed to look like. And with our faculty selection, aligning them with that educational survey, I truly feel that this is going to help meet that educational journey, regardless of your experience within the industry today, or at an expert level.
I can see this being part of an orientation process for new people.
Oh,
This gives them, unfortunately, orientation in many places is a fixed document that you go in, it's a check off and say, yeah, we went through all of that. We went through the manuals, whether you did or not, you check it off, you say you did. This is part of that orientation process that's necessary, especially with C-suite, I think. I think if you're running an operation, you need to attend this, because this is what's going to give you the information that you need to run your organization profitably.
Yeah. Go ahead, John.
You go.
I'll remember what I was going to say.
All I was going to say is that y'all do a really good job also of making it fun. So it's educational, but in the best way possible. It's relaxing for an operator. This is not an easy job. There's a lot of stress that goes on. So I love the fact that it's also environment that's relaxing and that induces that education or that free thinking.
In our first year, we had people dancing on the stage before we even started the conference. And the other thing I experienced, and you did too probably, Christina, is at the end of the conference time, people came up to me and said, I don't want to leave. I want to stay. I want more. I don't feel like I'm ready to leave yet. And most of the time at conferences, by the end of 2 or 3 days, just like,
you're done.
I want to go home.
Yeah.
That's not what happens here. And we have a party that's, I think, by invite only, but there's no party like an Access party. It is great time. It's great interaction with everybody. We have dancing, we have bands. It's tremendous, and it's all part of the package. Christina, can you talk a little bit about the leadership portion of the conference? I know that we have a leadership day, and there's no charge for that. Is that correct?
Yeah. So every year at Agile, we have a few different swim lanes. And so intentionally, we want to create an educational conference that helps to meet you regardless of what swim lane you're in. So to Arlene's question, John Alajade, our CEO, he always hosts a leadership forum That particular forum is invite only. And that is typically the industry leaders within the care at home who come together and network, and they have specific educational sessions for the leadership forum. And again, that is invite only. The second swim lane that we created, which we've already talked about, is the Hope Intensive and the Home Health Revenue Optimization. Those particular workshops can be for all levels. So whether your C-suite down to the director of nursing, it's really going to be tailored, regardless of what your title is. You are going to learn and be able to take practical insights and apply them to your role. We're also going to conduct 2 general sessions this year. One general session will be focused on workforce, of course. And then the second general session is going to be focused on reframing the value of home-based care. Again, that's going to speak to all audiences. So whether you're new to the industry or you've been in the industry for quite some time, it's going to lean back into what we have known, thread through to where we are today, and then push you into the future. And then the last swim lane is what we call concurrent sessions. The concurrent sessions is kind of where you, as an attendee, get to pick your own journey. And so whether you're in the hospice or palliative world or home health or home care, we're going to have specificity, and we're also going to have sessions that include all specificity. So that will lean into the area of scrutiny, everyone's favorite, right? Scrutiny, innovation, growth, as well as revenue diversification. So those are the 3 swim lanes, and again, very intentional on how we design it, because we want to meet all learners regardless of role.
I think Arlene had kind of said it when we first started. Being in home care today and being sort of the central part of post-acute care, right, of making sure these patients don't go to the hospital, is becoming more and more appropriate, or more and more important. And I just met this guy in RGB named Israel Torres, and I'm stealing his phrase. He said, we need to be the shield and the spear for our doctors, right?
Mm-hmm.
That we are protecting them, and that we're going out and getting the information that we need. But if we don't even know how to do that, then we're setting ourselves up for failure. We're setting our doctors up for failure. We're setting our community up for failure. So it's very important that we don't just wing this sort of situation, but we really invest in educating ourselves to the best practices and finding ways to push our industry to get better, because we're all, we can always do a little bit better.
Right. Last year, workforce scarcity was the buzz, right? We don't have enough workers. We don't have, honestly, today, it's no longer workforce scarcity. It really is about attracting people into our industry, right? So a few years ago, I was on the road. I really love employee engagement. So I was on the road doing a lot of education on employee engagement. And I basically stated, it's time for us as leaders to bring sexy back to the care at home industry. So how are we attracting people who have worked in brick and mortars, or how are we attracting people who have worked in concierge type environment, like hotel environments? Like, how are we creating a unique ask to take a look at our industry and empower individuals to think about how it could be a gig economy opportunity for them, right? We really need to think about it differently. It's not workforce scarcity, because they're there. We just have to attract them to our industry. Right. And so Agile is designed to empower the attendees to think creatively about their organizations, from every aspect. and what do you need to do differently regarding your organization to be the employer of choice, right? Really, at the end of the day, you want to be that employer of choice. You cannot continue to be the same. And I use this because I love Chick-fil-A's model. It is the same model regardless of where you go, but you do not need a hospice and home health model the same in every single community. It needs to be very unique to that community. And so that uniqueness of that organization should attract new workforce because of what you're doing to differentiate yourself as an employer of choice. And Agile is designed to do that. Again, going back to that practical insights, that innovation insights playbook that we're going to give the attendees, because we want you to think outside of the Chick-fil-A box, if that makes sense. Think a little bit differently about who you are.
I think oftentimes, and Arlene and I talk about this all the time, that our industry is not like other industries. And so we want to use our MBAs and our Chick-fil-A models to come up with this perfect efficiency of scale, but we're cutting off our nose to spite our face because, you know, New Braunfels, Texas is different than Plano, that's different than the Valley, that's different than Oklahoma, Florida, Michigan. And if we think the people are the same, if we think that it's going to be the same, we're just wrong. And it's usually too late because it's 3, 4, 5 months down the road when we're catching whatever issue it is. And most of the time, you know, bad patient outcomes and definitely your referral sources are not feeling the love, right?
Yeah, yeah. I mean, rural versus urban. When I think back to being the operational leader, Pennsylvania, New Jersey, and Delaware were the states that I supported. But now I live in North Carolina. And so the difference of the community engagement when it comes to care at home, it's different from one state to another, and it's different from rural versus urban.
Yep.
And how you meet the educational needs of each community is very different. But that's a whole nother podcast.
So let's just go over the details again. Agile. What is Agile? Is an acronym, isn't it?
Yes.
What does it stand for?
So it stands for Access, Growth, Innovation, Leadership, Experience.
And that is what everybody will be getting if they come to this amazing conference, May 5th through the 7th in Dallas, Texas. I think we have a code as well, Arlene. What was that code again? Do you know?
Oh.
I'm gonna put it up in the
Okay. I think it's Arlene AG25.
Okay. Arlene AG25. So, Christine, is there anything else that you would like people to know about Agile
Just let me say this first.
Yeah. Go for
Okay.
it.
So that code will give you $100 off on your ticket to come to Agile. And if you're an Agile agency, if you use a particular code, and I'm not sure what that is, but I can find out and let John post that with the when we put this up for to air or whatever you call that. Okay, so if you're an Agile agency, or Agile, see there I am, Christina, calling it Agile Access Agency, you get $200 off with a particular code, and there's a deadline for that. And so you want to make sure that you get in there and have an opportunity to get that discount. And I think there's a deadline for discounts at the Fairmont Hotel that we're
April 25th. Yeah.
Right. Yeah. So you want to make sure you go ahead, Christine.
Yeah, I was just gonna, John, can I just share my screen real quick?
Please.
Okay. All right. Make sure I get the right screen. This one. Okay. So y'all should be able to see our Agile, which John has shown a few times, our Agile landing page. But I would like to encourage you, because if you're anything like me, you might remember 30% or less of what we've said today, right? So this is your one-stop shop. You can see up at the top, we have listed the agenda, we have details about our sessions, and we have details about our speakers. So to, I think John's earlier point or Arlene's earlier point, if you want to get to know our speakers, you can just come on in, you can click on the speaker, him or herself, and it will take you directly to who they are, their organization, their LinkedIn page, their bio. So this will give you an opportunity to see, well, okay, this is offsetting my Agile ticket because I am going to be receiving consultative services from all of these amazing faculty members.
I see some familiar faces in there.
Yeah, oh yeah. So I just encourage you to get to know the faculty. I don't want to make you dizzy, so I'm going to scroll up really slow back to the top. So as I mentioned, we also have our sessions listed. And so this gives you the opportunity to review each session in detail, so you will be able to see the description, what day and time, who the faculty are. And what's really cool, once you register, you get a little seat option. So a little seat, like you're in a movie theater, it's gonna pop up right here. And that particular seat is going to ensure that you lock your seat for the Agile conference. So anyhow, I would just encourage you, check out the Agile landing page, look at the speakers, connect with them on LinkedIn, take a look at the agenda in each sessions, get to know what your continuing education will be. By the way, we're offering 20 CEs for Agile this year. And if you have any questions, Arlene or I'm very happy and delighted to answer them.
Awesome. Well, thank you so much, Christina. Arlene, thank you for getting us the opportunity to talk to Christina about Agile. I'm super excited. Again, these sort of situations are what you put into it, right? What you get out of it, your mindset going in. How much do I want to learn? How much do I want to improve our industry, our organization? But it sounds like this conference is the place to have the best opportunity to do all three. So get your tickets. We said it was access.com/agile. So go get your registration done. Use the code ArleneAG25 for $100 off. That's awesome. Miss Christina, thank you so much for joining us.
Thank you for the invite.
Come see us, everybody. Come see us.
Through the 7th. Make sure you bring me a birthday present.
That's right. That's right.
All right, everybody. Thank you so much for watching another episode of Off the Cuff, All Things Healthcare. We'll see you next time.